All right, 22-year-old woman has joint pain, mild swelling, and tenderness in her wrists and her knees. There's also painless oral ulcers, and proteinuria and hematocrit is low, thrombocytopenia, and the VDRL test is false positive. Okay, so what is the condition? This is SLE and lupus. And so A, this is going to point us to rheumatoid arthritis. B is going to point us to dermatomyositis. C is the best test for SLE. And we'll dive into the rest of these in a second, like anticyclic citrullonated protein would be reactive arthritis, but we'll dive in here. So arthritis, malar rash, oral ulcers, all this stuff, fever, proteinuria, and anemia, low hematocrit, all this stuff is SLE. And so SLE is associated with a lot of different antibodies. This anti-double-stranded one is really good. Anti-Smith is highly specific, but it's less sensitive. I think it's like 20 to 30% will show it. ANA is highly sensitive, but not very specific, so it's just kind of general. And antiphospholipid can cause thrombosis and also this false positives. So that's the reason we got the false positive test. So looking at the other answers, anti-IgG is rheumatoid arthritis. Anti-Jo1 is polymyositis, and that's the proximal muscle weakness, not joint pain. Anti-centromeres are seen in limited systemic sclerosis of Crest syndrome, which features calcinosis, Raynaud's, esophageal dysmotility, and a lot of these other things. So anti-centromere is not the correct answer. And the citrullonated protein makes us think of rheumatoid arthritis, which is chronic joint inflammation with progressive deformity, not like non-deforming arthritis and lupus. So we have all the stuff with lupus, and anti-double-stranded DNA makes it the best answer. Hopefully this is helpful. If it was, like and subscribe.